More likely than not, you probably have had knee pain with lunging before. In this video, I'm going to show you a good alternative you can use to decrease this from happening. What's up, guys? My name is Dr. Nick Bonforte, physical therapist. So knee pain with lunging is a super common problem. It could be a knee dominant factor, it could be a loading factor in the patellar tendon, the quads, or it could be this common valgus force that we experience when we lunge and the knee caves in doing this. Now, if the knee is not able to tolerate that loading, that can contribute to a spark up into the knee. So this video is going to be focused on that particular problem where we are lunging, we can't control the knee staying straight over the toes and it caves in. Now, before diving into this and getting all wrapped up into the correction of what you could do for this, it's not to say that this movement is a bad movement. It's just a movement that your knee potentially might not be able to tolerate. So over time, whether it's repetitive times doing this, it sparks up in pain. Either way, it's a good alternative that you can do if the knee is not adaptable and cannot withstand the forces and stress upon it as it goes into this movement. So you might be thinking, how do you go about solving this type of issue and preventing the knee from collapsing in? Now, in the short term, if we're looking at it from the perspective of the knee is sparked up in discomfort or doesn't feel good as the knee goes in, it's a good modification you could do in the short term to minimize this from sparking up even more. All right, so the exercise is to actually facilitate the knee to cave in even more throughout the lunge. So this exercise, we're taking a band, we're placing it onto the outside of the knee. So now the band force actually wants to put my knee inward. That's super important throughout this exercise. I don't want to have it the other way where the band is trying to pull my knee out. Now remember, the knee is caving in because you can't control this motion throughout the lunge. So we take the band and it's actually forcing the knee inward. What this does, it helps give awareness to this region throughout the body. With the band pulling us in, the knee proprioceptors, the joint mechanics, all that stuff gets input into the spinal cord, goes up to the brain. You understand that you have a band pulling you. So what that does is allow you to go out on the band and keep good position as you go down into this lunge movement. So now we have feedback from this band that's trying to pull us in. Then we go against it and we stay in line with that second toe of the foot and we don't let it cave us in even further throughout this movement. So we have that band feedback. We use the glutes to get the knee out in line and then we go down and then come back. So it's super important to understand why the band is forcing us in because it's ultimately giving us feedback to go out against the band throughout this movement and help facilitate some good feedback throughout this movement with knee positioning in the right way. So hopefully you have a better understanding of why this exercise is an important one to help minimize the knee from collapsing in, ultimately helping knee issues with lunging. Guys, if you did find some value in this video and understand a little bit better about why it's important to be aware of how this movement can contribute to this issue and what you can do about it, then I would really appreciate it if you subscribe, like, comment, leave any questions down below. It really helps out with the YouTube algorithm. Also, don't forget to turn on your post notifications so you never miss a video once I release it. And guys, if you want to learn a little bit more about the programs that I have for this specific region at the knee and other programs that I build with my background in physical therapy and strength and conditioning all into one, then check out my website. I'll leave the link in this video or down below in the description. Click, that heads you right over to the website. Check out the program, some of the free guides that I have on there as well for this region and other regions of the body. This is Dr. Nick. See you next time.